Dr. Duperret about gentler and easier ways to rejuvenate your face with less downtime and less pain. So Dr. Duperret, how can you take somebody's face and neck and rejuvenate it that easily?
Well, the soft lift, which I often combine with a neck lift or a tiny little neck tucking, is the common thing we do at the office. So it's a combination of fillers, Botox, and sometimes a little surgical procedure depending on the patient.
Okay, so where do you begin? When you say a little neck tuck and you pointed here, do you mean that the scarring is just here?
Yeah, it's a small incision about 2 centimeters long just behind the mental crease that we have here, under the chin. And it's done there under local anesthesia with sedation or general anesthesia if needed. And that little muscle that hangs that we see in older people can be just zipped up or sutured up to correct a mild to moderate neck deformity. This we combine with the fillers in the face.
So the fillers are in the typical places, the cheeks, where? Here?
My number one, my favorite spot to rejuvenate a face as a starting point is the cheeks.
Okay.
Most people have a tear trough or a depressed area in the cheeks, and it's always younger looking when someone has a full cheek without looking unnatural.
Yes, and how do you avoid that? Because I think that is a common concern, is people do not want to come out looking like they've had fillers.
Yes, most patients, you're right, do not want to look unnatural. And the beauty with fillers, not only they last longer than we thought originally, but they allow the patient to be part of the project because the results are instant. So I tell the patients, let's start. I give them a handheld mirror, and we start. And then I show them after some parts of the project I call, they get to look and see, yes, it's enough for today, or yes, I agree we should put a little bit more.
Now, Dr. Mark, you mentioned that the fillers are lasting longer than you thought. Are you referring to permanent fillers or?
No, they're not permanent fillers. They're still temporary fillers, but we've found out over the years and by adding new applications to our fillers that if you inject the fillers deeper than the skin, and we imply on top of the bone, like on the cheeks, on the chin, pre and post jaws or the nasolabial line, the fillers will last much longer. And we're talking about 1-2 years and sometimes even longer.
Oh, that's amazing. So you really can rejuvenate yourself quite easily and less expensive and less downtime than having surgery.
Yeah, the no downtime is important. Safety and no downtime to all our patients because the traditional facelifts will be a 3 to 4 week downtime, and some people may require that, but for all of the other people who do not require it, the ability to get a rejuvenation process done in one or few stages without downtime is a big advantage.
Now, even people that have the full traditional facelift often need injections as well. Is that correct?
Yeah, it's a very good point. I know 10 years ago, most facelifts were done by just pulling the skin, removing the wrinkles, but would not address the lack or the loss of volume that we all get in our faces as we get older.
Right.
So even the most traditional facelifting procedures are not combined with some fillers to rejuvenate the cheeks, the periorbital area, and the lower face.
Now, I know that you, Dr. Mark, do some new work with fillers for nose rejuvenation. Can you just give me a little bit of information about that?
Yes. Fillers is great also for minor nasal deformities, which can be from birth, could be from trauma, or could be from a previous rhinoplasty. And for anything that's a lower bridge on the nose or a small deformity, a bit of filler injected in the location, sculpting the results will help the patient to just restore their nasal appearances without a full rhinoplasty.
Well, that's great news because I imagine that would be a big procedure. Now, if someone would like to find out more about these topics we've discussed today, how can they get in touch with you?
They can go on the website and contact us at skyviewspa.ca.
Great. Thanks for the great tips today.
Thank you.
Skyviewspa.ca for more information and to meet Dr. Duperret. Keeping you informed, I'm Sheila Clark, and you've been watching Daily Web TV.